Hi everyone, this is Neil Wright, consultant audiologist and director of ClearWax. Thank you for joining me in my latest video using the WAXscope. And here we have a patient aged 13 and they've been visiting me since they were 8, almost every 8 to 10 months on average. And the reason for that is that they secrete this very sticky, icky, honey syrupy type of wax. And they are due to go on holiday next week. So she asked her mum to take me to, she calls me Dr. Neil, although I'm not a doctor. She goes, I want to go and see Dr. Neil again. And so straight away I put some medical grade olive oil spray just to coagulate, bind this wax together. It did block the suction tube a couple of times, but this wax laterally here, it's more skin. You can see how sticky it is. And then we've got this deeper wax. This is the left ear. They felt this ear to be the worst, but the right side was actually a bit more blocked. It was a bit deeper, but they're experiencing the symptoms more on this side. Now, while she was here today, she said to me she wants to become an audiologist because of, so all the help I've helped with her ears over the years. And she's just asking for some advice. And I had to be brutally honest. I said, unfortunately, in the UK at the moment, the standards have changed for training for audiology. So I've suggested a couple of different routes for her, but because there's not much regulation, for example, anyone can call themselves an audiologist. It's not even a protected title. So I feel as though the profession in the UK is devalued a lot. It probably was a little bit when I first started my training, but that somewhat changed, but I think it's reversed, unfortunately. So I just obviously want to have the best honest advice, and I gave my business card and asked the mum to email me anytime if they've got any questions. Still obviously a bit young, may wish to pursue other things, but at the moment she's got her heart set on becoming an audiologist. So I've even offered to put her in touch with my ENT colleague locally, and she can observe some clinics. So I think next year or the year after, they have to attend work experience, so that would be a good one. So the left ear is clear, eardrum is nice and healthy. I have got a very bendy, narrow ear. In the past, I think it's the first time I've used the WAXscope in her ear because it is quite bendy and narrow. And because I'm so used to the WAXscope, even the most narrowest and bendiest ears with the endoscope, it's I kind of not find it easier, but I'm so accustomed to it. But I decided to use the WAXscope and it worked really, really well. Again, just suctioning out this very sticky, syrupy skin. And this wax is still a similar consistency, but a bit denser. And they had a thick blanket of skin at the floor. You'll see that as I lift this plug up. There's a layer of skin that was enveloped. You'll see it in a moment. And it was still somewhat attached to the canal wall. It's just slightly out of focus at the moment because I'm focusing on the wax a bit closer. I'm just going to get that in focus. I'm going to go to the top. With this type of wax, quite often there's a bit of staining afterwards because it's sticky. So there was a little bit non-significant. And there's that layer of skin, that blanket at the floor of the ear canal. And as I'm suctioning it, it's almost stretching. But when I remove that last section, immediately I can see some of the eardrum. I've just put some more oil in because it kept blocking my tube. I'm just going to suction the oil out first, get it back in focus. I'm just going to hover over. Unfortunately, a lot of that skin came away. So that's some of the staining. Now, I managed to get the bit closest to it. It's a bit deeper, but you wouldn't risk that in a young patient. It's not necessary. A bit of wax is good for us. So I'm just going to gently peel this up. So this is probably about halfway in the ear canal. It's on the bony part, so you need to be very, very gentle. Don't want to make contact with the bone. But this is where the WAXscope really helps because you've got such high magnification. They've just got this peripheral sticky wax skin near the entrance. Oh, I forgot to edit this bit out. I do apologise. I think I'm unblocking the tube. I'm just focusing. This is the juncture of the second bend. It's probably about 1 centimetre of the way in. It's the ear canal. There's a bit at the roof, so we'll just suction that away. And then we're going to mop up a little bit near the entrance. And then we'll have a final view of the eardrum. So do spend a little bit of time just getting this out of the way. Sometimes with this type of sticky wax, when patients go to sleep and if they lay on the ear, it kind of close the ear canal at the entrance, and it can act like a glue, so they wake up with a blocked ear. And I've had patients even with less sticky wax like this coating the canal wall experience that, so even removing that will help them, this section here. So this is just at where the first bend is. It's about 5 millimeters into the ear canal. And a good telltale sign is you'll see these hairs. The majority of the hairs are just surrounded around the first bend, and as you approach the second bend, they reduce in numbers. You shouldn't really have any hairs in the bony part of the ear canals because you don't have the dermis layer of skin where the hair follicles are attached to. So again, I'm just going to straighten the ears, but we've got a good view there of the eardrum. It's nice and healthy. Well, I hope you enjoyed that video, guys. Take care, keep well, and speak soon. Bye.